There's a lot of oversight organizations that look over a study before it gets approved, before it reaches being offered to patients. Drug studies in particular are studied in cell lines and then in animals, and have a lot of regulatory carefulness. And in part, you see that reflected in the consent process. So, Lisa's saying, oh my gosh, there's a long, long stack of things that I'm looking at. And part of that is because there is such attention to detail, including in that packet, they're describing in excruciating detail the side effects that may occur with the standard treatment, which actually, if you didn't participate in the study, you probably wouldn't hear in that level of detail.
We're very careful. Patients receive a very lengthy informed consent that explains absolutely every step of what the clinical trial will do, so that they'll know what the information is that we already know about the study drug, what would be done if they didn't go on the study, information about the potential side effects that we already know that come from this particular drug, all the steps of what will be done to them. So there's a lot of protection provided within that informed consent, and they get a copy of that after they've signed it, so that they will always have that information with them. It's not just that we're explaining it to you, but we're also providing you with a copy of the informed consent. Many of the studies actually have additional brochures that further explain it. So there's lots of information. And the studies involve a lot of testing, a lot of us constantly checking for side effects and late effects, for problems, so that there's lots of opportunity for us to make sure that the patient doesn't get hurt.
Most of the studies, long before they're ever implemented, there's a whole vetting process that they go through to look at these studies. What's being done? Has it been done before? Can we leverage what's been done before and add something extra to it? So the studies from the National Cancer Institute, they look at them. I know Dr. George put forth several, and they'll go before committees, and they'll go through them, and they'll actually vet them, and it's very rigorous. So by the time they actually go to implement the study, it's been looked at by people who know a lot about it, and they're saying, yes, there's something to be gained by doing it this way versus that way.
Each study is vigorously vetted by a board of experts. These are scientists, physicians, radiologists, pharmacists, experts of ethics, and they each review the study for merit, scientific merit, as well as risk of injury to patients. And they will not approve a study unless the risk is minimized or adequate provision has been made for any risk of injury to the patients. Also, before you consent to be in a study, we do inform you about all the risks that are potentially involved in being a part of the study before you decide to participate in the study. So we try to be as safe, try to minimize risk as much as we can. And before an investigator recruits patients, this board has to approve the study as well as re-review it periodically to ensure that if there's new information, the patient is not being withheld treatment, that could improve their care.